I'm going to start with a bit of the good news, because I think we've all really suffered quite a bit over the past year, over the course of this pandemic. We are now in the United States to get 200 million shots in arms within 100 days, which is double the original target. And I will say, a couple months ago, even 100 million shots in arms, I was very skeptical that we would be able to do that. But the pharmaceutical companies really have come through with the supply that we need to distribute. And we've massively ramped up our distribution capacity through a number of different partners, ranging from the retail pharmacy community, health centers, and FEMA mass vaccination sites. So we've really ramped up our distribution significantly. We are reaching 3 million doses in arms a day on some days now, although I don't think we're going to be getting significantly higher than that 3 million per day mark in the coming months. That's a very good high plateau to have reached. By May 1st, all Americans adults eligible to be vaccinated in this country. Many states are opening up even before that May 1st deadline. And already over 70% of people over the age of 65 in this country have received at least one vaccination. Over half have been fully vaccinated, and about a third of all American adults have received at least one vaccination. So as a result of this, we have seen a drop in hospitalizations, in particular among residents of long-term care facilities and people over the age of 65. That does not apply, of course, to people who have not yet been vaccinated, and I'll come to that in a little bit. Also, in the past week, we have learned that the Pfizer and Moderna vaccines are both safe and effective in pregnant women, women who are trying to get pregnant, and women who are breastfeeding. We don't yet have that same data with the Johnson & Johnson, and that's really because the Pfizer and Moderna vaccines were available sooner in the United States, their FDA emergency use authorization sooner. But we anticipate having similar data, hopefully equally good data, on the Johnson & Johnson vaccine before too long. And then just in the last day, Pfizer has announced the results of its trials of its vaccine among 12 to 15-year-olds, and the vaccine is also safe, effective in preventing infection, not just symptomatic disease in adolescents. So this is all really wonderful news. We also learned in the past week that the Pfizer and Moderna vaccines prevent infection, not just disease and death. It's about an 80% reduction in the risk of infection 14 days after the first dose, a 90% reduction in infections 14 days after the second dose. Now, 100%. And so one message I want to leave you with here about that is that, yes, these vaccines are truly revolutionary. They're highly effective. They're very safe, but they're not perfect. And as long as you have a high burden of community transmission, which we do in much of the world right now, you still do have to layer different interventions. And the way I think about this is that the vaccines are sort of like a good raincoat and umbrella, effective in keeping you safe and dry in a regular thunderstorm. But right now we're dealing with a COVID hurricane. And so those basic measures in a hurricane are not going to be enough to keep you safe and dry. So if you're vaccinated, you do still need to wear a mask when you're out in public and should be avoiding crowds. So with respect to the Biden plan, over the past week, the president has announced this new 90, trying to expand vaccination and distribution. By April 19th, over 90% of US adults will be eligible for vaccination across the country, 100% by May 1st. And by expanding vaccination sites, 90% of the US population will also be within 5 miles of a vaccination site. And this is being accomplished in a couple ways. We're going to be more than double retail pharmacies that are distributing vaccines, going from about 17,000 sites to 40,000 sites across the country. Also increasing the number of FEMA mass vaccination sites. There are currently 21, and we'll be adding another 12 in the coming 3 weeks. I just want to note that over 60% of the shots given at these FEMA mass vaccination sites are going to the most vulnerable communities. These communities of color have been hit so especially hard. And so they've been really an important tool in making sure that we have equitable distribution of the vaccines. In addition, the Biden plan is allowing for or providing transportation for seniors, for disabled persons who may not have easy access to vaccination sites otherwise. Now, turning to the bad news, unfortunately, the pandemic is not over yet. In the United States, has had plateaued at about 50 to 60,000 new cases per day. And we know from previous experience throughout the pandemic, when you see a plateau, that's going to be followed by a surge, not a decline. And so we are now starting to see the beginnings of that surge. Over the last several days, our cases have increased to over 70,000 new cases per day. We are still seeing about 1,000 deaths per day on average, though, of course, that is a lagging, so we won't really understand the full impact on deaths for another several weeks. And I think it's important to understand what is behind this surge. There is no question that people are relaxing on some of the mitigation measures. Governors are lifting, rescinding mask mandates. We're reopening indoor businesses, including restaurants and bars and gyms. And we're not adhering as much distancing in general. That is certainly fueling the surge that we're seeing now. In addition, every time there's been an increase in travel, whether that was over the 4th of July or over Thanksgiving, over the winter holidays, and now over spring break, it's not so much the time on the plane, it's that you're bringing people from different households together, mixing people from across the country, and that has also every time driven a surge. Also seeing that pattern again now. Now, I think the one other wrench in all of this that's different is the spread, the rise and spread of these new different variants. You have the B.1.1.7 variant, which was first identified in the UK. That's probably the most important one in the United States right now. And this variant is more infectious, so it spreads more easily from person to person. It's more virulent, so it causes more severe disease. And what we are seeing as part of that is, one, it's fueling transmission. It's part of the reason we're seeing an increase in cases, but we're also seeing more cases, severe cases of COVID among younger people, people in their 30s, 40s, and 50s who have not been vaccinated yet, because many of them been eligible, but continue to be exposed. And this B.1.1.7 variant seems to be causing more severe disease, driving an increase in hospitalizations in that population. So even with all adults in the US eligible for vaccination by May 1st, it's important to remember they're not going to be instantly vaccinated on May 1st. It will still take us some time. And in the meantime, we really do need to keep our guard up and continue with at least some of these mitigation measures. With respect to the B.1.1.7 variant, I do think it's helpful to look at what's happened in the UK and in Europe. This is what in part also drove the surge that the UK saw over the winter months, what resulted in the need to re-implement strict lockdowns there. We're now seeing a similar pattern in countries like France and Germany and Italy, where we've seen a surge in cases where these countries have had to reinstitute strict mitigation measures. In Paris, for example, the hospitals are overrun, and it's anticipated that they will be announcing strict lockdowns again in France shortly. Some of the other variants that we're worried about, however, at least in the United States, is this new B.1.526 variant, which arose in the New York City area. This variant also does seem to be more infectious, and it is really the dominant variant strain that we're seeing in New York City, and is somewhere after that. And this new variant that emerged here in New York City seems to also be driving the surge we're seeing in the northeast of the United States. Another concern with this is that it's not just more infectious, but that it may evade the immune response to natural infection and the monoclonal antibody therapies, which have been developed to treat COVID. And so this is something we're keeping a very close eye on throughout the country. And then, of course, there are the variants that emerged in South Africa, the B1351, and the variant that emerged in Brazil, the P1 variants. And those are concerning because they do seem to evade the natural, the immune response to natural infection, and they are relatively more resistant to the immune response from vaccination. To be clear, the vaccines still work, but there is a trend in that direction where in a body you need to neutralize the virus with those variants is higher. In Brazil, this has resulted also in a big surge in cases with the P1 variant. As we've seen, again, hospitals overrun, running out of oxygen, cemeteries so overrun that they're having to build vertical graves. And so this really speaks to the need to, one, be very cognizant of what's happening to the emergence of these variants, scaling up genomic surveillance, something that we in the United States still haven't done enough of, although we have increased the scale of that in the last month or two. And really that's the only way to know what's happening and how to anticipate what's coming next. The pharmaceutical companies, Pfizer, Moderna, and so on, are retooling their vaccines to develop second-generation vaccines that live or more effective against the B1351 South Africa variant and the P1 Brazil variant, but that will take time. And then, of course, there's the logistics of distributing a booster shot. I think this also speaks to the need for equity in vaccine distribution, not just within a country, but worldwide. One of the risk factors really for the emergence of these variants is when you allow the virus to spread out of control, to spread like wildfire. And the more the virus transmits from person to person, the more it mutates. And then you have a process of natural selection where some of those more fit variants will become the dominant strain, will evolve. And that's precisely what we've seen in countries like the UK, like South Africa, like Brazil, like the United States, where we have allowed the virus to spread far too much. And we've seen these variants arise. And so even very high vaccination rates in our own countries, if there continues to be significant spread elsewhere, that can still lead to the rise of new, more infectious or immune evading variants, which are dangerous to all of us. I think one other example I want to bring up is the experience of Chile. They've really been one of the great successes with respect to vaccine rollout. Chile, the UK have actually been some of the farthest ahead in terms of getting their populations vaccinated. And Chile, when already a third of their population had been vaccinated, saw a new surge in cases. And this also seems to be in the face of the spread of variants, in particular, in their case, the UK B117 variant and the Brazil P1 variant. And so again, the message here is that just because you've started vaccinating, you can right away rescind your mitigation measures. You really do need to continue those measures until you achieve enough population coverage with the vaccine. And then finally, I just wanted to close on a discussion of the WHO report that came out this week. I think what's unfortunate here is that when you have a lack of transparency creates mistrust, and mistrust leads to conspiracy. And so I think it's important to step back and recognize that some of the world's leading virologists have looked at the genome of the SARS-CoV-2 virus, seen no evidence that this was manufactured in a lab, that this was altered in a lab to become more infectious or virulent. Is a lab accident possible? It is possible, yes. The Wuhan Institute of Virology studies respiratory pathogens from bats as wildlife. And so it is possible that there could have been a lab accident, and that really does need to be investigated, in addition to some really broader population testing of the people living in that area, as well as the wildlife and farm animals in that area. The most likely source of SARS-CoV-2 remains bats, possibly being transmitted through an intermediary host to humans. But again, really the controversy over this WHO report really speaks to the need for improved transparency on behalf of China, and really stronger collaboration, cooperation across the global community with respect to issues of global health. And that means sharing responsibility, sharing the costs and resources, and seeing this really as one global health system, not national individual systems.